everyone, welcome to another session of SRK where we are doing the difference between the upper motor neuron lesion and the lower motor neuron lesion. Very important question and it is a repeat topic. So let us start. Now first thing I want all of you to learn in the beginning, motor neuron lesion, remember up, everything is increased. What is increased? I will tell you. In lower motor neuron lesion, we see decrease, right? So what all is increased in the upper motor neuron lesion? Please remember tone and the deep reflexes and the Binsky sign, right? Now, all of this, the tone is increased in upper motor neuron lesion, the deep tendon reflexes are increased in upper motor neuron lesion. Binsky sign is positive in upper motor neuron lesion, increase, right? Next, in lower motor neuron lesion, everyone, all these three are decreased, right? So tone is decreased, deep tendon reflexes are decreased, Binsky sign is negative. So this is the first thing I want all of you to learn. Upper motor neurons means up, lower motor neuron means decrease. Now coming to the chart, very important chart everyone, and I want all of you to learn it with me. Okay, now in this first thing beta, upper motor neuron lesion, please remember upper motor neurons, they are coming from the brain, right? From the brain up till the anterior horn cells. From anterior horn cells to the nerve is the lower motor neuron. Now, upper motor neurons, they supply a group of muscles, right? So, when there will be some paralysis of the upper motor neurons, we will see muscles affected in group. Very important. Whereas in lower motor neuron, we are supplying just one muscle. So, only one muscle is affected. Individual one muscle is affected. Major difference, everyone. Obviously, if you know there is the nerve damage to a single muscle, then the atrophy will be very high in intensity. So, in the lower motor, we see atrophy. Whereas in the upper motor neuron lesion, atrophy is minimal or no atrophy, right? Third point, type of paralysis. Repeat question, everyone. Please circle it and write down spasticity and rigidity. In upper motor neuron palsy, we have spastic paralysis and rigidity. Repeat question. Okay. Whereas in lower motor neuron palsy, we have flaccid paralysis. So please know lower motor neuron. Whereas rigidity or spastic paralysis is occurring in the upper motor neuron lesion. The power everyone, tone, I told you tone is up in upper motor neuron palsy. So in the upper motor neuron palsy, we have hypertonia. Whereas in lower motor, we have hypotonia. This so we learned, right? Next is deep tendon reflexes. Again, I told you up. So deep tendon reflexes are increased in the upper motor neuron palsy, whereas they are decreased or absent in lower motor palsy. Clonus may be present in the upper motor neuron palsy, but it is absent in the lower motor neuron palsy. Now, superficial reflexes, everyone, it is absent in both. So, this is a difference that it is not following the up and down rule. The superficial reflexes are absent in both. Binsky sign again follows the up-down rule. Binsky sign is positive in the upper motor neuron palsy, whereas it is negative in the lower motor neuron palsy. Now, fasciculation, obviously when one muscle is involved, we'll have fasciculations. So, fasciculation are present in the lower motor neuron, but they are absent in the upper motor neuron. Again, I have learnt it like fasciculation, L is coming, so lower motor neuron, right? Flaccid paralysis, L is coming, so lower motor neuron. Next, the 11th point is not that important, but we should do it. The denervation potential, EMG changes and reaction of degeneration is absent in the upper motor neuron palsy, but present in the lower motor palsy. Next, nerve conduction. In the upper motor, we don't see any abnormality in the nerve conduction. However, here there is decreased or abnormal nerve conduction in the lower motor neuron palsy. So everyone, up is for upper motor neuron. What is up? The tone, the deep tendon reflexes, Binsky sign. Whereas, remember, lower motor, all of these are not there. Binsky sign is negative in lower motor neuron palsy. Next, one muscle is affected in? Answer, upper or lower? Lower. Atrophy is maximum in? Lower. Yes, everyone. Hypertonia, where do we see? Upper. Rigidity and spastic paralysis, where do I see? Upper motor or lower motor? Answer. Very good. Now, Binsky sign, everyone. With the help of a instrument, the lateral aspect of the sole is stroked from the heel to the thumb. Right, you see the direction. And what happens? If it goes, the toes go down, then it is known as a negative or a normal Binsky reaction. If the toes flare up, they go up. See, bete, up, positive. Right, if they go up, the toes go up, then it is known as positive. And where do I see it? I see it in upper motor neuron lesion, whereas negative I see normally or in the lower motor neuron lesion. So this diagram of Binsky sign can come. So you should all be very, very well aware of this. And now I hope upper motor neuron lesion versus lower motor neuron lesion is crystal clear. Thank you.